It gets better, by the way. I was talking to somebody recently who explained to me that at a conference 2 years ago held by the IRS, he was told by several senior agents that most of the veteran agents of the IRS, auditors, field agents, all of those people, are retiring. Early retirement in many cases. They're getting out fast as they can. They see what's coming. They see how overwhelmed the IRS is going to be trying to handle this thing. So what you're going to have is 16,000 new recruits who have no experience trying to understand a bill that's what, 20,000 pages long? And that was literally passed with some of the pages blank. They filled them in later. Do you know what chaos that's going to be? What an absolute mess it's going to be? How many people they're going to charge fines on who have health insurance, and then you're going to have to fight it? And in case you don't realize this, the IRS has its own court system. You'll be having to fight it in their court system. And in their court system, they don't care about precedents. They don't care about a lot of things. It's really hard to fight. The veterans all know it, and they're leaving. So, millions will be dropped off of private health insurance. What effect do you think that's going to have on them? They won't be covering children. Lots of companies will be dropping people, making them either part-time or just paying the fee. What do you think the effect that's going to have on the insurance companies? I mean, I'm not going to say poor little insurance companies, because if you go downtown, two of the biggest buildings down there are insurance company buildings. What's going to happen? They won't need as many people to work for them, will they? Not with so many people dropping out of the health insurance. And I'll bet you anything that where they can, they're going to drop their own employees' health insurance and take the fine. But they'll be losing money. They'll have to do something to try to save themselves. Where does it end? The more we regulate things, the worse it'll get. And by the way, I don't know how many of you saw this in the paper. It was easy to miss. I almost did. A little tiny article about tort reform. Texas passed a constitutional amendment for tort reform. Healthcare costs have not dropped at all. Hasn't affected a single thing. Hasn't actually even changed jury awards. Because, you know, those really massive jury awards for somebody who like spills coffee in their laps or something like that, and everybody is going, oh, that's horrible, how can they do that? I'll bet you can only name less than a handful. Most jury awards, when it's medical problems, are what they should be. They're not extravagant. And even in those few cases, the insurance companies or somebody else usually appeals it. The appellate court usually says, you're right, that's too high, and chops it way down. The more we regulate, the worse it gets. Now, if it was up to me, and it's not, I would say deregulate. Throw out the Health Care Reform Act, first of all. Shred it, chop it into pieces, burn the pieces, separate the pieces, put the separated pieces in concrete, and then dump them in different parts of the ocean so they can never reform. Kind of like I have to do with a master vampire, but that's just, another side thought in my brain. Just how my brain works sometimes, Scary, I know, but deregulate. It's like with the shipping. When suddenly everybody was competing on fair ground, prices started dropping. Same with the airlines. People started offering different kinds of services. You can pay $200 and get a meal, or you can pay $99 and bring a sandwich on board. That's your choice. It's competition. Allow insurance companies to compete across state lines. I've never understood why they can't. Deregulate them. Get the government out of the way. First thing you'll have is most insurance companies will take on children again. And those companies who are willing to take on children with very bad pre-existing conditions will still be there. And you'll see prices dropping while insurance companies start fighting each other. Look what's happened with auto insurance. You just watch some of the TV commercials. These people are fighting desperately to get your business. Lowest prices guaranteed, vanishing deductibles. Our agents are your best friend. They'll show up at your accident. Why? They'll cause it if they have to, but they'll be right there. They compete and they compete and they compete. And yes, now you can get really cheap insurance that doesn't cover a lot, covers what's necessary.
Today, only death. And maybe a birth.
It's what's necessary. You deregulate the insurance companies and you'll see a lot of policies for just major medical problems. And a lot of people would go for that. It'd be a lot cheaper. Doctors' offices would, well, a lot of doctors' offices already will. They'll ask you if you have health insurance, and if you say no, they quote you a different price. A lower price. And if you would come to them and say, well, all I have is major medical, they'll consider you uninsured for regular treatment. And then you've got insurance still, so if you end up in the hospital, you're okay. Deregulate. Get the government out of the way. Government forced companies not to be able to do that anymore. Offer just major medical. I mean, you will end up with some things like that incredibly bad health insurance we looked at one time, where if they were having surgery and they pre-approved for surgery on, say, your gallbladder, and while the surgeon is in there, they happen to notice something wrong with your intestines, they couldn't fix it. They would have to sew you up, cut you again, and then fix the intestines, so they could charge you separately for both surgeries. We took one look at that, Paul and I did, and said, I don't think so. What are you, insane? But that's the problem. And we are rapidly going towards it. Another year and a half or so, it'll kick into effect. And if you think things are bad now, just wait. Just wait. You know, this might come as a shock to you, but I do believe that the government that rules the least rules the best. There are things that government should do, there are things that government must do, and there's an awful lot of things that government meddles in that it should have no business doing. I'll give you a final for instance. The federal government should not have a Department of Education. It has no business having one. Education has traditionally been a local issue only. When mandates are coming down from the federal government, parents no longer have any say-so. When mandates are coming down from the state level, parents no longer have any say-so. It should be between the parents and the school board. And I really don't understand why we dump so much money into schools and still have a high failure rate. I am a history buff, and I look back in the education of our country. You know, there was a time when there was a little room like this size. You had students from kindergarten to 12th grade. Teacher had to teach them all. Of course, back then, if the kids weren't learning very well, the parents fired the teacher. Hired somebody new. Even in the bigger cities back then, it was the parents that controlled things. But then again, it was handled differently. You know, there's a huge disconnect when I don't even do it. It's an even bigger disconnect than I was about to say. My bank collects money from me once a month. And part of that money it puts into an escrow account to pay my property tax. Do not get me started on property taxes. I never see the money. I have no real connection with what's going on. They're taking the money and sticking it over here in this account, and every so often they hand it to the government. The government then disperses that money in various ways, and part of that way is to the school, and the school then uses it to pay the teachers. I'm greatly removed from the whole process. On the other hand, if I was a parent, and this was the old days, I'd be giving money directly to the teacher for my child's education. And my child better be learning that. Because I can see my money going from my hand to the teacher's hand. And if my child isn't learning, we're getting a new teacher, or that kid's going to a different school. Or I'm bringing them home and hiring a tutor. That used to happen quite a bit. Or if I'm able, I'm bringing them home and teaching them. But since it's now so far removed, wow, just let the government handle it. They must know what they're doing. I bring up the education system because of the high failure rate, and I want you to think about it. Under the Healthcare Reform Act, more and more people are going to start losing their insurance. They're going to turn to the government for help. They'll end up on Medicare. The more and more people that end up on Medicare, well, they won't let doctors and hospitals after a while drop them. Matter of fact, I bet you that by 2015, they'll pass a law saying you have to take Medicare patients, period. Soon after, my guess will be, we'll just pay your salary doctors from the tax pool. Not long after that, they'll start doing what they do in England. This doctor's got too many patients. He's being overwhelmed. This doctor doesn't have that many patients. So a third of your patients are now her patients. What do the patients think about that? Oh, well, this is for the best. Besides, those third of the patients live closer to this doctor, so they should go to that doctor. You have no real say in it now. That's basically the way it works in England. They assign you a doctor, and they pay that doctor. Now, if it's anything like how the schools are running, do we really want close to a 50% failure rate in our doctors? Our hospitals? I don't know about you, but when that day comes, well, before that day comes, as a matter of fact, now that I think about it, I'm going to start working on it today. I'm going to try to get a hold of my grandmother. See, my grandmother always used to talk about her mom, and she said her mom could walk into a field and tell you, this can treat that, and this will treat this, and that will. I want to know what those plants were. Grandma never paid attention and had no idea what most of them were. So I need to get a hold of great-grandma and start taking some walks in the woods and start putting medicines behind. Because I got the feeling in 5 years or so, 10 years, well, sure you've got a tumor. Sure you should have surgery and radiation after that, but, well, you're in your 60s and we don't know how much productivity you have left anymore, and we have limited resources and limited money and limited time, and there's this 19-year-old who's going to start college who also has a tumor. We'd rather have them get the treatment. Now, I want great-grandma to tell me what weed I can take, what leaf I can eat, what berry I can crush. I don't care. I want to know all of these things. And you'll thank me for it. Because if I can figure all this out, you'll be lining outside my door. Yeah, but I'm a history buff. And I know what happened to the wise women of Europe who had that knowledge. They were called witches. They were burned at the stake. Tough choice, huh? Mark my words, I am not making a prediction based on my psychic mediumship abilities. I'm making a prediction based on the study of history and economics and politics and human nature. These things will come to pass because we're already seeing a lot of it happen. And we've seen it happen time after time after time. And what we should do to fight it? Well, contact your state senator and representative. Tell them you don't want the Health Care Reform Act to be implemented in Ohio. Contact the governor. And I don't mean just once or twice. Pester them. Keep sending messages to them. We had an issue we were trying to get information on. We have been sending emails to every senator and representative in Ohio for almost 2 years. We finally got some responses. Pester them. Contact your federal Senate and representative. And not just the ones in our district. Contact all of them. They represent Ohio, you're an Ohioan, contact all of them. Pester them. Be a nuisance. You know, I was never this kind of a kid. Of course, I was an angel. But the kid that stands there going, Mom, 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 gets attention. Gets yelled at. My experience is anything. But gets attention. Contact them. Let them know how you feel. Let them know your worries, your concerns. If enough people do, maybe they'll listen. Or maybe they'll get around to reading the bill. I doubt it. Because our experience is a short email is often too much for them to read. But just maybe they'll listen. I guarantee you this much. They won't listen if we don't speak. And with that, I'd like to close, and we'd like to take up our free will offering.